Hello, and welcome to the Dance Physio Podcast, a podcast designed to explore ideas and foster discussion around dancer health and wellness. We're here to challenge the status quo, bridge the gap between dance science and the studio, and help change the landscape of the dance industry for the better. I'm your host, Erika Mayall, a dancer turned physiotherapist who is deeply passionate about leaving the dance world better than I found it. I'm so glad you're here. Let's get started. Hello, and welcome back to another episode of the Dance Physio Podcast. Today, we're going to be talking about injury rates in dancers and a little bit about the landscape of what the sort of injury statistics and current sort of surveillance of injuries in dancers looks like. A little bit of background about how the topic of this podcast came about. Earlier this week, there was a Facebook post in a number of different Facebook groups. So there are a bunch of Facebook groups that I belong to that are dance educators and dance healthcare professionals and things like that. And there was somebody who was posting some fairly aggressive posts within these groups. And they've actually since been removed, so I couldn't even go back and look at like what the wording of the post was. But essentially, they were calling out teachers and just saying like, all of you bad teachers out there, stop being bad. You're causing all these injuries, and that's why injury rates in dancers are so much higher than in rugby players and in other sports. And like just this very, very aggressive sort of tone in the posts. And I think they were trying to sell some sort of a program or something. So they were a little bit kind of spammy in nature, and I think deliberately trying to get a bit of a reaction and a bit of a rise out of people to sort of drum up conversation around those posts. They were removed from the groups that they were posted in, and they were posted in multiple Facebook groups, and moderators went in and removed them, but it created a lot of sort of tensions and I don't know if controversy is the right word within these groups, but also created some decent discussion in terms of like, are these statistics true? Because teachers were sort of asking the person who posted to back up these claims with statistics. And of course, they weren't really willing to do that. And they just kind of kept spewing aggressive replies, but not actually really backing up what they were posting. And so after these posts got removed, there was other teachers who were sort of posting and saying, does anybody have any resources on this? Like, was this true? Are there statistics that back this up? And so I chimed in with some kind of stats and research and some facts. And it actually generated some pretty decent discussion, but it also became really apparent that the vast majority of people working within the dance industry, like if you are just a dance, and I don't mean just a dance educator, but if you are a dance educator, so your day-to-day is in the studio and you're working with dancers or you're working in companies or things like that, you actually maybe don't have a good idea about what the current landscape with regards to sort of dance injuries and things like that is. And there's lots of us, especially people who are really involved in the dance medicine and science research side of things, where I think we maybe sometimes assume that everybody knows some of these statistics or some of these facts, but in reality, I actually don't think people do. So I just wanted to take the time in this episode to break down some of this, because I think like sort of the gist of the post, and one of the things that I think one of the posts was saying is dance has one of the highest injury rates among all sports. And is that true or is that not true? And so we can actually break that down and look at some of the statistics and where do we lie. And then some of the conversations that were coming up were, okay, well, if injury rates are that high in dance and if they are higher than other sports, like, are all the injuries comparable? Like, do we see more serious injuries in some sports and less serious injuries in dance or things like that? Like, what types of injuries are we seeing? How does that break down in terms of where those injuries lie? So that's what we're going to dive into a bit today, is looking at some of the statistics regarding injury rates themselves, but then also looking at kind of breaking those down further in terms of like, what are the most common types of injuries that we see in dance and how does that affect dancers' ability to dance? So before we get into the actual statistics, because I will tell you some numbers, because the person who was sort of trying to be a bit controversial on Facebook wasn't really willing to back up their claims with any sort of facts, but there are lots of statistics out there. So we'll get into those in a minute. But first of all, I want to give you a bit of a definition when we're talking about dance injuries of what are we actually talking about, because this becomes really important. You'll see from the statistics that they are quite variable. And there's a bunch of reasons for that we'll dive into in a minute. But we also need to know sort of what we're talking about. So IADMS, which is the International Association for Dance Medicine and Science, convened a working group, this was quite a few years ago, to sort of try and come up with a standard definition of what a dance injury is. Because if we actually want to look and study the rates of dance injuries, we need to make sure that we're looking at and comparing the same thing. So like that sort of saying of we want to be comparing apples to apples as opposed to apples to oranges. So they came up with a working group definition, and this is what is most commonly used by researchers now who are conducting research into dance injuries. So the current definition is a dance injury is an anatomic tissue level impairment diagnosed by a licensed healthcare professional that results in full-time loss of participation in class, rehearsal, or performance for one or more days beyond the day of onset. I'm going to read that for you guys again because I know that that is a mouthful, and then we're going to break some of that down. So again, a dance injury is an anatomic tissue level impairment diagnosed by a licensed healthcare professional that results in full-time loss of participation in class, rehearsal, or performance for one or more days beyond the day of onset. So there's a few key components of this injury definition that are really important to keep in mind when we start to dive into the statistics behind them. So the first one being that in order for it to be classified as a dance injury in research that we are looking at, it needs to be diagnosed by a licensed healthcare professional. And we know that in the vast majority of dance injuries, maybe that's not quite fair, but in a large percentage of dance injuries, dancers may not actually access healthcare. So they may injure themselves and they may choose to self-manage it. They may report it to a dance teacher. They may report it to a parent, things like that, but they may not actually access care from a licensed healthcare professional, which is what is required for this to be considered an injury, to be included in like research kind of statistics. So we have to keep that in mind that when we're looking at these statistics, we're actually probably missing a large percentage of injuries for dancers who maybe have not actually sought out healthcare from a licensed healthcare professional. So that's one thing that we need to keep in mind. The second part of this is time loss of participation in class, rehearsal, or performance. And so again, how many dancers do we know who have had an injury or have an injury, but they actually don't stop participating? So they don't miss a class, they don't miss a rehearsal, they don't miss a performance. They either just kind of, suck it up and grin and bear it, or whatever those sayings are, or they may modify what they're doing. So it's not uncommon to have dancers who might actually modify choreography, because if they have an injury, maybe they're like, okay, well, I need to take these parts out, but I'm still going to participate. I'm still going to perform, things like that. So if we're only including time loss injuries, we call these time loss injuries. If we're only including time loss injuries, when we're looking at injury statistics, we're missing a huge portion of injuries as well. So there are studies, and if you're ever reading research on dance injuries, it's really important to actually look at what the inclusion or exclusion criteria is, because some of them will define a dance injury as a time loss injury, and that's specifically what they are looking for in their study. And other research will actually look at what they will call kind of all physical complaints. So that might be dancers who report pain or report an injury, but that has not actually resulted in time loss beyond the day of onset. So these are just things to keep in mind, that it actually becomes really nuanced when we're looking at this. So it's not as simple as saying, oh, this is the injury rate in dance, or the injury rate in dance is higher than in other sports or lower than in other sports, because we really have to make sure that we are comparing apples to apples, which is hard across sports and also hard across dance, just with regards to different dance genres and things like that. And we'll get into that a little bit more when we kind of look at some of these actual statistics. So the other thing we need to know a little bit about is how injuries are actually reported, or how injury rates are actually reported. And there's a couple of different methods that can be used. And the most common that we will see are two sort of measurement tools, one that we call prevalence of injuries and one that we would call incidence of injuries. And they're slightly different. So injury prevalence, and this is used in all like epidemiological studies, so this could be on disease and things like that as well. But when we're looking at prevalence, we are looking at the percent or a proportion of a population that has this condition. So in our case, we're looking at the proportion of dancers who are injured in a study. So if they have a study group of, say, 100 people and they have 20 dancers that are injured, they would be looking at a 20% prevalence rate. When we're looking at prevalence, we're looking at a specific point in time. So it's either like a collection period, if you're looking at a study where they're kind of designing it and tracking injury over the course of, say, like a dance season. But it can also be taken in a moment in time. So this is not necessarily always going to be new injuries. This could also be dancers who are dealing with an injury that started even before data collection started, but they currently have an injury at a specific point in time. So that is prevalence. We think of prevalence as a proportion, and it is almost always reported as a percentage. And so this is like often easy for people to kind of understand because we're used to sort of percentages in other areas of our lives. We also look at injury incidence. So incidence would be the number of new cases. So in our case, when we're looking at injuries, it's the number of new injuries that happen over a specified period of time. And if we want to be able to compare these numbers to sports literature, so we're looking at like dance injury rates versus different sports, say soccer injury rates or gymnastics injury rates or things like that, we want to make sure that we're using similar collection parameters that they use in sports. And one of the most common ones that they use is exposure hours. So they'll report it as X number of injuries per, and it's usually 1,000, although different studies can have different criteria, but it's usually 1,000 hours of exposure. So for every 1,000 hours of exposure, and so that in dance would be like rehearsals or classes or performances or whatever, how many injuries do we see? So if we are reporting it the same way in dance as they are in other sports, it makes it a little bit easier for us to compare across those different populations. So what are the actual numbers if we sort of look at this? So if we go back to prevalence, so remember that's the proportion or the percentage of a population that is going to have an injury, we see numbers of anywhere between 42 and 97% across dance populations. So that is massively variable. That's like a huge, huge amount of variability within 42 to 97%. If you look a little bit more, sort of start to dig a little bit deeper, I would say on average, we often see numbers around 80% prevalence rate. So that's like a fairly common number that shows up, but there are studies that are as low as 42% and there are studies that are as high as 97%. There's reasons for this massive amount of variability, and it's not just that people like aren't conducting good research, because that isn't the reason we see so much variability, but it really, really depends on what populations we're looking at. So within dance, we see very different injury rates in younger, adolescent, more amateur populations of dancers than we see in professional level dancers, for instance. So we actually see a lower injury rate in professional dancers than we see in adolescent dancers. And a lot of studies look really specifically at certain populations. So they're only looking at, say, adolescent dancers, or they're looking at pre-professional dancers, or they're looking at college-age dancers. There's actually quite a lot of research that happens with university or college-level dancers because they're easy to access, I would say, a lot of the time, because they're already in sort of a university or research setting. So if we look at those dancers versus looking at professional dancers in a more company setting, or even professional dancers in a freelance setting have different injury rates than in a company setting. So huge variability that happens with regards to the level of dancers we're looking at. And then there's also different injury rates when we break it down by different genres. So again, we want to, as much as possible, make sure we're comparing apples to apples. And so we might look at studies that look specifically at ballet, or studies that look specifically at break dancers, or studies that look specifically at Irish dance. So our injury rates are going to be different depending on genres of dance, because all of those genres are very, very different from each other. So the injuries we expect to see in a ballet dancer are going to be quite different than the injuries we expect to see in like an acro dancer or any sort of genre like that. And, if you're within the dance world, you understand that. If you look at these different styles of dance, like you can see how like, oh yes, the injuries that are going to happen would be quite different across those populations. So that accounts for a lot of that variability that we see in these prevalence numbers, sort of like ranging from sort of 40s up into potentially like 90%. So if we look at incidence, so again, remember this is the number of injuries reported over 1,000 hours of exposure, we have variability within this as well. So on the lower end, we see 1 or sort of like 0.99, but like kind of 1 injury per 1,000 hours of exposure. And on the upper end, we see 4.9. So again, these numbers don't necessarily mean a lot to people. Like if a teacher just hears that, like kind of individually, I think the percentages, the prevalence is easier for people to like wrap their brain around. The incidence numbers are a little bit harder to kind of figure out, okay, what does that even mean? Like in terms of like, what is 1,000 exposure hours and things like that. But like I said, incidence numbers make it a little bit easier for us to compare across sporting populations. So I just jotted down a few other sports really quickly. I mean, you can dive into specifics with other ones, but so if we think about, again, that upper end of incidence injuries in dance was 4.9 injuries. In football, and this is American football, not soccer, but in American football, we see 3.96, so close to 4, so not hugely different, but still lower than dance injuries. Girls soccer has an incidence number of around 2.5 or 2.65. We see an incidence number of 2.36 in wrestling. So all of these numbers are slightly lower than the upper end of dance injuries. But again, remember there was huge variability within the dance injuries. So anywhere from 1 up until 4.9 within some of the research for dance injuries. So even within incidents, we see a big variability of injuries in through there. So it's not super easy to just like flat out say, the injury rate in dance is 80% or the injury rate in dance is 70% or whatever, because there's just so much variability in play. And I think that's an important thing to remember, and something that, again, like if we come back to sort of the inspiration behind this podcast was that sort of post where dance teachers were, I think, feeling like a little bit attacked and definitely sort of called out. And they were like, wait a second, like what we're doing is not necessarily inherently less safe. Like, are these statistics actually true? And so we just have to remember that there's a lot of variability and it is hard to compare against different sports. But if we actually break down the numbers and look at it, then yes, dance does have very high injury rates compared to other sports and other athletic populations. I think there's a lot of variables and factors that feed into that, and maybe that will be a different podcast episode because I'm not going to get into that today. But I do want to break down just a little bit more in terms of like what types of injuries do we see and how does that break down across populations. So before I get into that, just tying back to how we talked about these statistics or the prevalence and incidence numbers that I just told you really relate back to those definitions of injury that probably are those diagnosed by a licensed healthcare practitioner and these time loss injuries. So just keep that in mind. But there's also been studies that have just looked at the prevalence of pain. So not necessarily a diagnosed kind of anatomic tissue level impairment, but just dancers who have pain. And if we look at the prevalence rate, so again, that's our percentage, the prevalence rate of pain in dancers is 95% across a 12-month period. So that means, if we think about it in practical terms, especially if you're a dance teacher, if you have a classroom full of dancers, 95% of them are going to experience pain at some point in a 12-month or a 1-year period of time. And I think when we think about it like that like honestly probably does not surprise people if we're not thinking of it about it so much as like an injury that's keeping us out of dance, just something that is producing pain in the body. And I actually don't have statistics to compare against other athletic populations, but I would imagine it's probably similar in other sporting populations that people, when we're testing our body and challenging our body at a high level, it is not uncommon to have pain that doesn't always lead to an injury that would be then classified as like a time loss injury or something that would be diagnosed. So we might have somebody who has pain for a day or two and then it goes away. And so it doesn't ever lead into something else. So sometimes when you're looking at injury research, if you see these numbers that are really, really high, what they're actually looking at is prevalence of pain and not necessarily a prevalence of like a diagnosed injury that is more of that anatomic tissue level impairment. If we break down injuries a little bit further within dance injuries specifically, one of the differences that we see compared to other sporting or other athletic populations is we have a much higher proportion of overuse injuries. So in dance, about 75% of the injuries that we see are what we would consider overuse or chronic type injuries, and about 25% of injuries are more acute injuries. So acute injuries are those ones that happen kind of all of a sudden. So you roll over on your ankle and sprain your ankle, or you go to kick your leg and you pull your hamstring, or things like that that happen all of a sudden in a moment in time. In dance, we have a much higher proportion of overuse injuries. And again, I think this is probably unsurprising, especially if you are a dance teacher or you work a lot with dancers. You probably already kind of instinctively know that. And that was one of the points that came up. A lot of the teachers were sort of saying, well, in dance, like the injuries aren't as serious as they are in other sports necessarily. Like, and there was some comments about comparing things to like football players and things like that. And that may be true. And some of that may be a result of, like I said, them being more of these kind of overuse type injuries. That doesn't automatically make them less serious injuries, but it is more of these overuse injuries as opposed to the more kind of dramatic acute injuries that you might see in a sporting population, where you see a soccer player go in for a ball and like tear their ACL or things like that are just these more dramatic injuries that happen. So the majority of injuries that happen in dancers are these overuse type injuries. We also know the majority of injuries that happen involve soft tissues in dancers. So again, we don't see as many fractures or as many concussions or those types of injuries or nerve type injuries or things like that in a dance population. Those injuries tend to be more associated with acute or more traumatic injury causes that might be impact type injuries or things like that. So unsurprisingly, we see more soft tissue injuries. So those are injuries involving the muscles, the tendons, the ligaments. And that is probably, again, unsurprising to people who work with dancers, because we have more of these overuse injuries. It is going to be the soft tissues that tend to be the thing that breaks down or starts to create issues or cause problems with injuries in that sense. Because most injuries or the majority of injuries involve soft tissues, the majority of injuries do fall into the more mild or moderate classification of injuries. And these are classifications that there's a few variables involved, but can involve things like how much time is actually needed away from sport or things like that. And so we see in soft tissue injuries, and especially kind of these overuse soft tissue injuries, that they tend to, if managed and treated properly, result in less time loss. And so they're not necessarily going to be considered as severe as some injuries that we see in other sports. And so in other sports, we maybe do see a higher percentage of severe injuries if it is, again, like a contact sport where we might see more fractures or dislocations or things like that than we see in dance. So the majority of injuries, although our injury rates are very high, we see a high number of injuries, the majority of them fall into that mild or moderate category. So the overall burden of injury may not actually be higher than other sports when we start to factor in sort of severity of injury as well. The majority of injuries in dance happen in the lower extremity. This is probably, again, unsurprising when you think about a lot of styles of dance that are very lower extremity or lower body heavy. And the most commonly injured body part that we see is foot and ankle injuries. So foot and ankle injuries often make up, and depending again on what study you're looking at, they often make up about 50% of injuries that we see in dancers are sort of foot and ankle injuries. If we're looking at lower extremity in general, so that's kind of like from the waist down essentially, so hip, knee, foot, ankle, those types of structures, those statistics are anywhere from 65 or 66% up to about 90% of injuries are lower extremity. So it is a huge proportion of injuries that are lower extremity injuries. And then again, within those lower extremity injuries, majority of those are foot and ankle injuries. So that just gives you a little bit of a breakdown. And again, like those of you who are a dancer, have worked with dancers, have a dancer, that's probably unsurprising to you. You probably have either experienced yourself or had friends or had colleagues who have, plantar fasciitis or Achilles tendinopathy, or, the list goes on of things that happen sort of in lower extremity and in foot and ankle. So that just gives us a little bit of a breakdown. So I realize that that's a lot of information and a lot of kind of statistics and numbers and facts today, but I just thought it was important to come on because, like I said, it really became apparent to me that through these discussions through Facebook that teachers really were quite surprised to hear that the injury rates were as high as they are in the dance industry and in the dance field. And so if we want to look at changing these injury rates and decreasing, ideally, these injury rates in dancers, we really, really need to start at sort of like the grassroots level, if you will. So teachers are one of, if probably not, like the most effective people to be able to influence this and impact change in injury rates, because you guys are the ones who are working with dancers day in and day out in the studios. And so if teachers are not currently aware of or don't understand what the sort of current burden of injury in the dance industry is, then there's not going to be a lot of motivation or incentive or sort of like a realization of a need to address this. So I think the first step is making these statistics maybe a little bit more commonplace and sort of making the dance industry itself aware of it, and not to be like doom and gloom. Like that's not the idea behind it. And that was, I think, why people really kind of were riled up by this Facebook post, because the post was like I said, very kind of aggressive and a little bit accusatory, like in nature. And that is absolutely 100% not my intention with this. But in order for us to see change happen, we really need to know like where we're starting from. How do we implement change if we don't even know that change needs to happen? And so I think it's important for dance teachers to realize that this is like the current state of the industry, and that they really do have a massive, massive role to play in being able to impact this. And if we can even decrease injury rates, a small amount, like ideally we want to decrease them a large amount, but if we can even start by just decreasing injury rates like small amounts, that's going to have a massive, massive impact on the dance industry, just with how many dancers we have coming through studio settings and how many dancers are involved in dance. So again, the point of this episode was not to sort of be all doom and gloom and be like, dance is dangerous, people shouldn't be doing it, or anything along those lines, but really just to raise awareness. This is kind of the current state of affairs, if you will, and where can we then go from here to really look at impacting these injury rates. So I welcome all comments or discussion surrounding this. If you were surprised about some of these injury rates, or maybe unaware of the injury statistics in the dance world as it currently stands, I would really encourage you to have some conversations with some of your colleagues, some of your friends, some of your fellow dance teachers, some of your fellow dancers, if you're a professional dancer, just to start to, again, raise the awareness of like, okay, this is where we're currently at. What can we start to do about it? And I will dive into that in lots more upcoming episodes in terms of like, what can we do about it? But like I said, just getting the conversation started. So if you, were at all surprised by these injury rates, or maybe even if you weren't surprised, but you think there's people who are maybe not aware of where things currently stand, I would really encourage you, and that can be your sort of call to action for today, to go out, start a discussion, start to raise that awareness. And if you are a dance educator, to really start to raise that awareness with your dance students as well, because if they are more aware of it, then they may also be more invested in things that are going to help their health and wellness or help with injury prevention. Because sometimes the buy-in for injury prevention with dancers can be difficult because it's not necessarily the like fun, exciting part of dance that they're really interested in. So I will leave you with that today. Like I said, please continue the conversation going. If you have any comments, questions, if you want any more resources with regards to anything I talked about today on the podcast, please let me know. Send me a DM, send me an email. I love all the conversations that have been happening within my DMs. And thank you so much for listening.